welcome in to be our guest. And we have with us today one of our favorite people, Dr. Tom Kincer. And Dr. Kincer, we're going to let you tell the audience exactly what capacity you serve in.
All right. Well, thank you, Virginia.
You're so welcome.
I'm the chairman and residency director of the Baptist Family Medicine Residency. Now, we call it the Montgomery Family Medicine Residency Program, but it truly is at Baptist. Now, what I actually do there is multiple things. So first, I am a family physician, a board-certified family physician. I came here about 20 years ago, me and Dr. Sam Saliba, to start the program for Baptist under Mike DeBoer, if you remember Mike DeBoer.
Yes.
So Mike had a vision of putting primary care into the central Alabama region. And the best way to do that was through having a training program for family medicine. So Dr. Saliba and I started the program about 20 years ago, and we've grown it over the past 20 years to include resident physicians and now the UAB medical students.
Yes. Very few people, I think, really are that aware. We actually, thank God, have a UAB, Montgomery Regional Medical School, right here. Right next to Baptist.
That's correct.
Right there. And the greatest shortage, we have a tremendous shortage in physicians, period. But probably the greatest shortage is in family medicine, I would assume.
It is, in primary care in general. So family medicine is the largest primary care specialty. We have about 7 family medicine residencies in the state, but we were really missing the central Alabama region. And we had a large deficit of family physicians there. So starting the program, we started out initially recruiting 6 residents per year and graduating those with the goal of putting them into practice here in the Montgomery region.
Absolutely.
The program was so successful that after about 10 years, we expanded it to include 8 residents per year. We have graduated over 100 family physicians from this program.
Nice.
In the past 20 years. Currently, about 40% of those are still in the Montgomery region.
Beautiful.
And
Thank you, Lord.
70% are still in Alabama.
Wonderful.
So it's been a great mission. Now, the residency program, just for the audience, we take medical students who have graduated from medical school and who want to specialize in family medicine, and then they come here and they spend 3 years with us in training to be a family physician. On completion of their training, they take a board exam and they pass it, and then they become board-certified family physicians. They can be licensed to practice medicine in the state, and that's when they can do different things. Our graduates, even within Montgomery, work for the urgent cares.
Yes.
They work in the emergency departments. They're hospitalists. Some of them are in private practices around town. Some of them actually are staying in the residency program, being faculty along with me. And some of them do geriatric medicine, like in the nursing homes and even home visits. So it's a wide array of practice types.
We need to let our viewers know the importance of primary care medicine. Is that a lot of times you have to, in your life, in your medical life, you have to have a baseline.
You do.
Of things about you as the individual. Every one of us is different. The chemistry, I'm not telling you anything new.
That's right.
We're letting our viewers know that. But when you, especially as you start to age and you have some problems, the first thing they want to do is go back and check that baseline to see how what's happening now is differentiated from that baseline. So we really need to impress that, don't we?
We do. We really do, and that's one of the many roles of a family physician is prevention of diseases.
Yes.
You know, we've all heard an ounce of prevention is worth a pound of cure, and that is so true in family medicine. So we're there to make sure that you have preventive medicine, but we're also there to treat medical illnesses that you may have as well. That we see a lot of diabetes in the region, a lot of heart disease, stroke prevention, but it's about immunizations and well-being, and just the whole package is what family medicine is. And the thing about family medicine that really differentiates us from other primary care specialties is we deal with everyone. Even in the residency program, we do OB, we do deliveries.
OB.
Yeah, so we have newborns all the way up through geriatrics. I think currently my youngest patient is about 14 months old, and my oldest patient just turned 98.
Wow.
Yeah.
Are you seeing an increase in the need for geriatric services? I would think you are.
Oh, most definitely, most definitely. And with the healthcare changing, you're finding a lot of physicians are having difficulty keeping up with taking care of the Medicare population.
Correct.
So in the residency program, we're able to do that in large numbers because we have 24 resident physicians and we have 5 faculty, so we have 29 physicians in our office. We see over 100 patients a day in the office, plus we do hospital care as well. So last year we had over 30,000 visits to our practice.
Well, how would our audience, a patient in our audience, get to you?
Well, they can call the number directly to our office,
okay.
Which is 613-3680, or they can call Baptist Hospital, any of the hospitals,
okay.
and just ask for Baptist Family Medicine and they'll transfer them to our office.
Perfect.
Good.
Wonderful. And thank you for being with us, and we'll be right back.